Hi everyone, my name's Anthony James. I'm an ST3 GP trainee working in North London, and I'm also chair of the RCGP's trainee committee. Over the last few weeks, we've been obviously seeing the impact that COVID-19 is having on all trainees, and part of that has involved the postponement of exams, the CSA and the AKT. And we know that that's going to have a big impact on trainees, particularly for those coming towards the end of their training who are now raising lots of questions around their ability to progress and get a CCT. Personally, this is an issue for me. I was meant to be sitting my CSA in just a couple of weeks' time in the April diet. And obviously now we'll be sharing a lot of the same feelings as many of you out there, feeling uncertain about what the future might look like. And so today, hopefully, we're going to be able to start to answer some of the many questions that have been coming into the college over the last few weeks. I'm joined by Dr. Michael Mullholland, who's a GP in Buckinghamshire and also the college's Vice Chair for Professional Development. So has a big portfolio which includes everything from exams and assessments to accreditation. So hopefully we'll also be able to help answer some of the important questions that all of you have been raising. So I guess if we kick off with the first question. So Michael, from your perspective, can you tell us what happened with the MRCGP and kind of where we're at with that at the minute?
Okay, hi. So I'm a trainer as well, so I can see in my own practice with trainees what the issues are and the stress this is causing. So I hope that we'll be able to answer some of those questions. What happened was we were working through our normal exam plan as COVID started at the beginning of this year. Our biggest and busiest time for exam diets is the March diet going into April to get most trainees at ST3 through in time to get CCT towards the end of the year, the academic year. As we got to March, we began to see that COVID was having a bigger impact. The isolation rules had begun, but we thought we could keep going and hope to get through the whole of our March diet. Unfortunately, as we got closer and the rules increased so that families were being restricted as well as the individual with symptoms, we were finding not only were more of our exam panel and our role-playing actors having to go off, but actually many candidates were also telling us they couldn't come along to the exam sessions. That meant that we also had the restrictions that were starting to come, that people weren't wanting to travel, that you shouldn't be leaving home very far and you shouldn't be coming to London. So we had to finally make a decision when it became unviable to actually have enough people to run the exam. And it didn't seem safe to ask candidates to come from around the country, putting themselves at risk, that on the 18th of March, we had to suddenly stop it after only 5 days of that big exam diet that was ongoing.
Okay. And that was obviously now a number of weeks ago. And in terms of next steps, why haven't we seen kind of details from the college about what will happen next for those trainees who can't complete their MRCGP?
I'm as frustrated with this delay as you are, Anthony, that we have, since we cancelled the exams and Pearson VUE stopped testing in their centres as well, we've had to spend time with other organisations trying to work out what the future plans are. The MRCGP exam is the part that we have control over, and with the social isolation we can't run that, but actually what happens to the trainees isn't within our gift to make that decision by ourselves. That also relies on the education providers, Health Education England, Education Scotland, and the providers in Wales and Northern Ireland as well. And it also relies on the GMC, because they're the ones that eventually give the licence to practice. So we've started meetings regularly with them. We're meeting increasingly frequently at the moment as they go back not only to the providers, but to look to their governments as well to work out how to get through this.
Mm-hmm. Yeah, I guess from my point of view as well, I've been part of some conversations and some meetings. And so I think just for trainees out there who are feeling uncertain and frustrated, you know, I'm definitely in the same boat of hoping to get a decision as soon as possible, but I have been reassured by the fact that it is a top priority for everyone to get this solved as soon as possible, and everybody appreciates the frustration and difficulty that trainees are experiencing, alongside having to cope with everything else that COVID-19 is throwing at them as well.
I think within college, this is a priority that's certainly at the top of my list of things that we have to do and get sorted as fast as we can. And as soon as we have answers, we will do it. It was slightly simpler to be able to sort out the internal parts around WPBA for other people coming up to ARCPs, But now that we're into the realms of working with across the GMC and the regulations and actually finding the space, until we know when COVID really isolation and rules are going to be relaxed, we don't know when we can start the exam diets again. But as soon as we have permission, we'll be able to start them.
Yeah. And I guess in other specialties, we have seen that some requirements around completing training have been slightly relaxed or have taken a bit more of a permissive approach to their final ARCPs. Is this something that we could do in general practice, or are there other kind of complexities that make us different to other specialties?
Yeah, the big difference between ourselves and other specialties is that CCT and the MRCGP exam are linked together. And we're the only college that has a licensing exam that confers CCT. So that's the difference, and that's why other colleges can give CCT at different stages based not on their MRCP exam or their FRCS, but based on the performance of a doctor as they've gone through their training. For us, people must pass MRCGP to get CCT according to the rules.
Mm. And I guess there's also an element of the way that we're practicing over the next however many months is going to be considerably different. For a lot of trainees, that will mean that we might have missed out on 5 or more months of kind of bread and butter general practice. And so given that our training is already fairly short, and there's such a quick run through, I guess from my perspective, there could also be some concerns that people might not have been able to get all of the benefits out of training, even if they will be learning a completely different, really useful skill set through the things that COVID are throwing at us. There will be other bits that they might not necessarily get to perfect or hone before the end of training.
Yeah, I think that's another one of the concerns as to if everybody was given CCT without having completed training and having gone through this period when we all know that every GP or many GPs are learning how to do different types of consultation. We're doing telephone triage a lot more and video consultation. We're not sure, is this the same training as you would have had if you'd been doing standard practice as you had planned? And so when it comes to looking at what qualification comes from the end of it and how prepared people are to take an exam, we want to make sure that trainees are as prepared as possible to get through the exam as they had planned on their first attempt.
Yeah. And I've seen there's a few trainees who've spoken to me about if there are any other kind of assessments that could be done in place of these exams. And some people have raised the potential of going for things like the SEGPA, which is the Certificate of Eligibility for GP Registration, I think. And that's a different type of assessment. Is that a potential option or something that this impacted cohort could do to get a CCT?
We've looked at all, within the groups that we're trying to work out answers in, we've looked at all these answers as people have suggested them to us. We've had suggestions about SEGPA, which is again a different route. It isn't a quick route. It tends to be a long process of portfolio being produced that shows an equivalent standard. And at the moment, it's not one that has been thought to be possible to get through any faster than any other route we had. The other people have also suggested some assessment to us. Why don't we go back to the way things were over 10 years ago? And again, that was a different standard of practice that people were being assessed in. So to maintain the standard and to make sure that people leaving training are qualified to the same level as everyone else, at the moment, the only option we can find is completing the examinations. The question is still how we do that and how you complete your training.
Yeah, and in terms of I guess examinations, I guess at the minute it's impossible to say when they might restart again. And I guess that's another concern about I guess about trainees being prepared is, as you say, this is going to be a very different way of working over the next 5 to 6 months, maybe even longer. And if we're not seeing patients face to face, then how will we make sure that people are ready to take the CSA and be best prepared to pass it or the AKT when it comes to that? So I guess from my perspective, the reassurance has been the reason the decision takes so long to make is because we want to ensure that safety and standards are protected, but also to protect trainees, to make sure they're well prepared to pass exams and get a CCT and be at the same standard and be regarded as being at the same standard as other GPs when it comes to the end of their training.
Absolutely. And I think that's the main bit, that we don't want anyone to be looked at afterwards as any different to any other GP that's passed the exam in other years. The fear is that people would say, no, you're the ones that didn't get the exam and therefore are different when it comes to employment prospects. So we've got to make sure that you can demonstrate that you've reached that standard too.
Mm-hmm. And there's been kind of recent publication of the gold guide around ARCPs and this new outcome 10. How do you think that will be being applied, or is there any kind of advice that we can give to trainees about that at the minute?
I think at the moment we're still trying to work through what the implications of that are. That talks about showing an equivalent standard to progress in training or to have additional time to gain skills that haven't been achieved. And I think whilst we're trying to get people through as fast as possible, we're just trying to see, is that going to make a difference? How does it work? Is there a way to actually get people trained roughly the same time as they were meant to finish anyway? It may be the outcome 10 is what people will have until they get the outcome 6 CCT, but we're not quite sure yet. And as I say, those discussions are going on. My phone calls are daily at the moment with the education providers, and we're having large group meetings at least once a week at the moment just to try and make sure everyone's connected and talking about the same things.
Yeah. And I guess when it comes to thinking about alternative assessments, and you mentioned kind of the previous summative assessments that existed, but even being able to complete those at the minute, if we're not seeing very many patients face to face, and when we are, it's a slightly different type of consultation. It wouldn't be the same. You wouldn't necessarily be able to get that the assessments, and they might not necessarily be of the same quality that people had before. So I guess that's another reason why it's more difficult to start thinking about alternatives. Because there's not really an easy way to be able to do anything at the minute.
No, it's hard. It's hard to do training at the moment, to know when tutorials are happening. With so many staff off in practice, I know a lot of trainers are having to spend their time doing clinical work rather than tutorials. You know that trainees are doing more clinical work as well and working very hard. And so it's very impressive the work that everybody is putting in as clinicians, whatever stage they're at, whether in training or out of it. And we know that this is not what you're planned for during your year, nor is it what trainers want to do. There's lots of stuff that I'm sure between now and the end of your training year they'd wanted to have time to go through and discuss and develop your skills in. And we hope that we'll still find a way that we can be reassured that you have got all the skills you need to be GPs at the end of this.
And I guess, what would you say? We kind of touched on this earlier by saying that exams were postponed now a number of weeks ago. What would you say to trainees who perhaps understandably are unhappy at the pace with how this issue is being resolved, and also around the communications that have come out from the college around this?
I would say that's fair. I think that I'm frustrated too by the pace, and the communications haven't been as good as I would have hoped. We had hoped that you and I would have this conversation a couple of weeks ago, thinking that we would have some definite plans to be able to share with people. And as everyone's hearing now, we still don't have those plans, but it's important that we do share where we're up to with everyone. So yeah, I think that's completely fair. If I was a trainee, I would be making exactly the same noises and complaining about it too. And my hope is that we'll be able to have these conversations more regularly as this goes on, to make sure everyone is up to date.
Yeah, I think from my perspective, sometimes it's easy to forget how frustrating it can feel for many other trainees who feel that they've kind of lost control over their training, feel very uncertain about what the future can hold. And it's been, for me, reassuring to be part of conversations and to be feeling potentially kept more up to date with things as they're developing. But I can definitely, if that wasn't happening, I can definitely appreciate just the lack of control in an already uncontrollable situation just kind of compounds everything. So I definitely can appreciate the frustrations that many trainees who are watching this feel. But again, it has been reassuring to see just how much of a priority this is for lots of people. It is a complex issue. It involves working with, as you say, Michael, lots of different organisations across the UK. And so I'm hopeful still that we'll have an answer and a solution as soon as possible. But yeah, I can appreciate that it's not been an easy decision to reach, and not an easy solution to find.
Thank you.
And in terms of kind of next steps, so you said that it would be good to continue to have these kind of open conversations, and I guess that comes back to the kind of communications coming out of the college. Do you agree that that's something that could be further improved upon?
Yeah, I think we're trying to get more communication out. The just a balance between giving communication that's accurate and actually is helpful to say that we're moved forward, and that which says we're still having the same discussions as we told you about 2 weeks, because I know both of them can be frustrating, or particularly if we don't give you good information as well as giving you bad. So I think every time we have an opportunity to pass on new things that will help people get clarity, we will do so. I think if you and I can continue these conversations, it gives us an opportunity to explore them a little bit more, particularly if there isn't certain news. But I'm hoping that we'll have so much more certainty in the next few weeks.
Yeah. And I guess this is a tough time for for everyone, including all trainees working around the UK. And there's a lot of issues that people are going to be facing, not just clinically, but also people who might not necessarily be able to sit their exams. They're balancing lots of other concerns about whether they'd be able to take on a new job when they were meant to finish training. That can have certain financial implications. I think it's just important to know that all of those concerns that you are raising are being heard here and are feeding into all of the discussions that are going on. Everybody here really appreciates all of the amazing hard work that trainees up and down the country are doing, and everything that you've done already, everything that you're going to continue to do. I guess I just want to say a big thank you. And I guess Michael probably would feel the same about that.
Absolutely. I think the work that everybody is doing is brilliant, and thank you, and continue with it. I struggle thinking back to my training, how I would have had to respond at this time. And I think the work that people are doing, the fact that people are continuing in general practice and continuing to work with the practice teams and really becoming integrated within those, so you're no longer seen as trainees, but seen as part of the real team that's delivering the care, and have adapted your consultations from what you've been taught and what we were traditionally teaching, which was face-to-face consultations, to take on board this new way of working remotely is fantastic. So thank you very much.
Thanks. So I think that's probably all of the kind of big questions that we're able to answer at the minute. As Michael says, this is going to be an ongoing conversation, and as new developments come up, then we will make sure that we keep you up to date. And then I agree with Michael, it would be good to continue these kind of conversations so that we can delve into certain issues in a little bit more detail. Again, a big thank you for everything that you're all doing to support your practices, to support your fellow trainees, and do continue to raise your concerns with your local reps. You can also access kind of discussion on the new college membership forum, which you can find on the website, and the college is also continuing to update its COVID pages, including the resource hub, with information that you'll all be able to find useful over the coming weeks and months as well. So please do keep up to date on the website as well. Any final words from you, Michael?
No, I think any concerns you have, please feed them to Anthony through the various committees, directly to him, through the members for him. I am hearing them all. And I can reassure you that they all are being brought to any discussions that we have. We know particularly about the concerns for those who have jobs planned and are worried about what's going to happen to them. And we're as keen to make sure that you can continue your careers as soon as possible, once we've got some certainty around what COVID is going to do and how we're going to get out of it at the other end.
Great.
Thank you.
Thanks everybody for listening. Stay safe, take care, and we'll all speak to you soon.